Excellent. Good evening, everyone, and welcome to a very special event in the ongoing series of UVA Department of Radiology and Medical Imaging Keynote Lectures. This one is extraordinary. This has nothing to do with radiology and imaging. This has to do with medicine around the planet. We have two extraordinary speakers today, Corey Feist and Dr. Tyson Bell. And I'd like to tell you about both of them at the outset so they can then speak freely amongst themselves. And I also want to invite everybody to be able to make your comments both in chat, and we have time at the end specifically to allow you to speak up. So starting first with Mr. Feist. Mr. Feist has served as the Chief Executive Officer for the UVA Physicians Group for the last several years. Before this, he was the Chief Operations Officer for the same group for several years, its General Counsel for a decade, and its Chief of Staff for half that. And before UVA, he was a Special Advisor to the CEO of the UVA Medical Center. To honor his sister-in-law, Dr. Lorna Breen's memory and the hard work of assessing physician burnout, they have initiated the Dr. Lorna Breen Heroes Foundation. You'll hear more about that. Corey will be leading us off, and then following with Dr. Tyson Bell, who's an assistant professor of medicine in both infectious disease and international health and pulmonary critical care medicine at UVA. Dr. Bell is the director of the medical intensive care unit, the ICU at UVA Health, and notably recently recognized as one of the 30 leaders under 40 changing healthcare by Business Insider. Also instrumental in bringing remdesivir to us, and he's going to be speaking about acknowledging the heroic efforts of healthcare workers during our pandemic and the demands that society is placing on our care providers, us, to keep people safe while things are falling apart and hopefully being sewn back together around us. So welcome to both of you. And Corey, the screen is yours and the platform's yours.
Thank you all for having me. It's really a pleasure to be here tonight. We're gonna touch on some tough topics, but some very important ones, probably few that are more time sensitive than this. And I'm gonna talk in particular around burnout, provider burnout. Many of you who are physicians or other healthcare providers or supporting those individuals know what I'm talking about. I'm gonna share my screen, and I'm gonna play a little video that was donated to us by the Association of American Medical Colleges for events like this, where it tells the story of how I got here in my newest role, which is as the co-founder of the Dr. Lorna Breen Heroes Foundation. And then after that, I'm gonna share a few words and bring it kind of current, and then tell you over some slides what the foundation's been doing and what it's been up to. So I'm gonna not stay in presenter or share screen mode the whole time so that it mixes it up a little bit. As we start, I'm gonna adjust the sound on my end. If you need to change it on your end, please go ahead. So Jennifer and I founded the Dr. Lorna Breen Heroes Foundation in June, and here's our story.
My sister was beautiful. She was the member of our family who was the brightest, the smartest. She was a great aunt, a crazy aunt to 8 nieces and nephews. Obviously, she was a doctor in Manhattan. She was a friend, she was a colleague, and she was kind of our shining star.
By all accounts, Dr. Lorna Breen exemplified all of the best qualities of a physician, but she found herself overwhelmed by the COVID crisis, even contracting the virus herself while serving as head of a New York City hospital emergency department.
Lorna was the toughest of the tough. If this can happen to Lorna, this can happen to any healthcare provider. One of the many things that we have been asked since Lorna's death is is what is our message to family members, to friends, to colleagues? And our message is simple. It's checking on each other. And don't wait.
And so while people on paper might say, no, mental health care is not a problem, it's not an issue, there's a stigma in saying, I can't handle this. That stigma is then reinforced by licensing laws in each state, many of which we believe violate the Americans with Disabilities Act because of the scope of their questions regarding prior mental health care and assistance for your entire life.
In talking about these issues openly, we believe will save many lives and will help destigmatize not only mental health, but also suicide for this country.
What we know and what we learned from this experience is that Lorna wasn't the only one.
David, according to a new survey out today, 1 of 4 physicians knows a doctor that has taken his or her own life. Experts say this was a public health crisis long before COVID-19, and the pandemic has only worked to heighten the issue.
We didn't understand at the time how bad it's gotten to be, and we didn't understand at the time how institutionalized it has become.
And when Lorna became so overworked and despondent that she was unable to move, do you know what she was worried about? Her job. She was worried that she would lose her medical license or be ostracized by her colleagues because she was suffering burnout due to her work on the front lines of the COVID-19 crisis. She was afraid to get help.
When my sister died, I said, this stop. The stigma has to change, and it's going to happen now.
It's for you,
We would
you
like
and mommy.
anyone who's watching this to join us on this journey. And we thank you for your support of all of our healthcare heroes in recognizing that before they were heroes, they were human and they need to be treated with dignity and respect.
So, as you saw in the video, Lorna was the medical director of the emergency department at the Allen in Manhattan. Allen is, she was on faculty at Columbia. Allen is one of several New York Presbyterian hospitals. For those of you who are at University of Virginia, the volume in the emergency department at the Allen is about the same as UVA's volume, though it's not a level 1 trauma facility. Lorna's career and her training was all in New York, though she went to Medical College of Virginia in Richmond and did her undergraduate school in Cornell. She trained at Long Island Jewish Hospital and worked a career at Columbia. What happened was her career brought her to the worst possible place at the worst possible time, which was Manhattan during the beginning of the COVID crisis. We were together skiing in Big Sky, Montana, the week that Donald Trump first addressed the nation. We were there with Lorna. She was talking about what they were starting to see in New York. This was the second week of March, right before the world shut down. It's interesting because we went from the beginning of that vacation from sitting and skiing and sleeping in late and eating out and drinking wine in the hot tub till she was really starting to very actively manage the emergency department and get more and more involved as the week progressed, missing more and more skiing, and then flew back on a Friday, March 14th, actually. And her first shift in the hospital was the 14th. That was actually the first day that the first 2 New York residents died from COVID. In an unbelievably short amount of time, Lorna got sick herself, was home for 10 days, while she was not sleeping and trying to rest, losing a tremendous amount of weight in the process. She was trying to manage the emergency department remotely, stay on top of her colleagues who were having to call out sick because they too had contracted the virus. As soon as she was fever-free for a handful of days, she called to get back on the schedule. Incredibly, she was still in school getting her MBA at the time. Didn't even think to pause her MBA to work on a global pandemic. In fact, she was trying to do both things at the same time. As you may have seen, a couple days after Lorna died, we were invited on the Today Show, and Jennifer, through tears, described Lorna's words for what it looked like her first day back on April 1st. And that was as Armageddon. She said people were dying everywhere. There were no places for bodies. There was not enough oxygen. There was not enough help. And it's interesting now, some 7 months and a handful of days later, that we're still hearing similar stories, but this time from different physicians and healthcare providers in different geographies. In fact, just last week, I received a call from an emergency department physician in Pennsylvania who had just finished her shift. And she told us that her department was at 130% capacity and that they've just, quote, started using the tents again. Lorna became so overworked and run down that she could literally no longer move. She called Jennifer, her sister, my wife, a lawyer, not a doctor, and said, "What do I do?" Jennifer created a help chain like no other and got a friend who was in Connecticut to drive into Manhattan, pack a bag for Lorna, drive her south to Philadelphia, where another childhood friend picked her up, and continued to drive her south. All the while Jennifer was driving north to rendezvous on the side of the road at 695 outside of Baltimore. Having no apparent physical illness, but yet barely able to function, Jennifer drove her directly to the emergency department at UVA, where she was admitted to 5 East, our inpatient psych unit. And she was mortified. She was mortified that she would lose her license, that she would lose her credentials, she would lose the respect of her peers, and that her career that she had worked tirelessly for would be over. When we talked to her during the time, and we talked to her every day while she was an inpatient on 5 East, we assumed she was mistaken. We assumed that no one would care. We even joked with her that her colleagues might think she was abducted because we had taken her phone and no one knew where she was, because we were trying to respect her wishes for privacy. Lorna was hospitalized for 11 days, discharged on April 21st, and died 5 days later by suicide. In the early days, the New York Times was calling about 15 hours after she died, and when we were getting texts and calls from reporters from all over the world, flowers started arriving at our home. We learned through many who had reached out that her concerns around her career, the respect of her colleagues, her license, though not in New York, but her license if she'd been in another state, were well-founded. Turns out that the field of medicine has this little secret, which is that anxiety and burnout are through the roof, but no one can get help. Before this pandemic began, physicians committed suicide at a rate twice that of the United States general population. In fact, more than 400 physicians each year died by suicide before this pandemic. Female physicians have a higher suicide rate than men, and emergency medicine is one of the highest specialties. It's known, according to the American Medical Association, while entering medical school, medical students start with stronger mental health profiles than their age-matched peers. But within a few years, they have rates of burnout that are significantly higher. We've also learned, as Jennifer said in that piece that you saw, that many states through the country have medical licensing laws that delay or deny admittance to physicians who have sought mental health care for any reason, such as having an appointment with a therapist, or albeit, an actual inpatient admission. The taboo in the mental health, to seek mental health treatment in the medical community, and it's certainly a known threat to your livelihoods. That was the dynamic that Lorna was operating under the pandemic. That was the dynamic under which you all as healthcare providers continue to work in today. And that, my friends, is the dynamic we need to change. I'd like to share just a couple stories. I'm going to share a few slides about our work since we started the foundation. But as you might imagine, we've received a few calls and a few emails and a few text messages from people who have been suffering in silence, or who have supported physicians or clinicians who have suffered in silence for many years. Here's a note we received this summer. My husband is a surgeon and was suicidal for most of last year. He was catatonic and profoundly depressed. The stigma attached to his mental health illness was most definitely one of the reasons things got so bad. He was terrified of taking medication, getting interventional psych treatments, taking time off work. It almost broke us. Here's a note I received from a physician in Kentucky. When it comes to mental health, our healthcare system is still literally in the dark ages when it comes to ignoring and fostering physician stress. We have a daughter about to embark on her residency, and I fear for her future unless significant reform can be brought about to end the stigma of mental health of physicians. There's one from September from a patient who sent us a note from her about her physician who died by suicide in California. Our dearest friend died by suicide September 26th. He became severely depressed in March, we believe, as a result of the negative pressures of COVID. And finally, a quick note that I received on Thanksgiving Eve from a physician. Remember the moment I heard about Dr. Breen's death? It's hard to
Thanks for finishing what I just shared with you. Everyone has.
If you guys can please mute your line, it's just hard to read. And remember the moment I heard about Dr. Breen's death, it's hard to even think about it. I'm sure you now understand some of the restrictions that exist which prevent physicians from reaching out for help when they need it. I sacrificed my 20s to become the doctor I always dreamed of, and the thought of losing it all was terrifying. Not losing it because I couldn't do my job, but losing it because of the stigma around mental health and physicians, and the thought that someone else would decide whether I was, quote, fit to be a physician. These thoughts paralyzed me from taking preventive action during times of extreme stress. After years of working with colleagues and residents, I know this is the rule, not the exception. We white knuckle it until we're drowning. Too often people look back and say, fine. Of course, not fine. Lorna's death was what pushed me to get help, the details of which I still don't talk about because I continue to fear it will be held against me when renewing my license or getting credentialed. All I can say is I saw myself in her story, and the reality of death suddenly outweighed fears about my license. I finally saw my physical safety as more important than my psychological safety, something that in retrospect seemed impossible after a life of delayed gratification, personal sacrifice, and moral injury. Every time I see a picture of her, I see myself. I see my residents, and I see my colleagues. So this is how Jennifer and I have found ourselves in this implausible story. We're doing this work in honor of Lorna, who cared so deeply, as deeply about her colleagues as her patients. We're doing this work to honor those who went before her, and in honor of you all and those who are working today, and for those who have yet to enter the healthcare world. I'm going to share my screen quickly and go through just a couple slides and share something that we got last night that I think you'll be interested in. Just from is helpful. So a little bit about our foundation. We started it in June officially after receiving an overwhelming amount of feedback that the fund that we had started after her death wasn't going to be enough and that we were going to need to really fully lean into the conversation. Our foundation is dedicated to reducing burnout of our healthcare professionals and safeguarding their well-being and job satisfaction. We envision a world where seeking mental health services is universally viewed as a sign of strength for healthcare professionals. We have two main bodies of work. The first is well underway. The second is it's on the to-do list. First is building awareness of these issues to reduce the stigma. And the second is funding research and programs that will reduce healthcare professional burnout and improve provider well-being. We've been working across the healthcare industry to accomplish these goals so far with national associations, with other healthcare systems, both state and federal governments, national and international news media, and others that are new to the party who just want to help, recognizing that our clinicians need our help desperately at this time. We've formed partnerships with over 20 organizations across the healthcare industry and beyond. There's a list on the screen for those of you who are watching this, who can see a handful of those on the screen. And we've now spoken with in more venues like this than I can even count. But starting about a week after Lorna's death, Jennifer talked to every medical student and resident in the country. And knowing my wife, she's going to do that. In terms of our awareness efforts, we have 4 publications, including U.S. News and World Report, published on the day that National Best Hospitals in America came out. We've published with the National Academy of Medicine, for those of you who know Pam Cipriano, the Dean of the School of Nursing, as well as a member of the National Academy of Medicine's Action Collaborative on Clinician Burnout and Wellbeing. We co-published with Pam that in the National Academy of Medicine publication. The Boston Globe on September 17th with the Dean of the Harvard School of Public Health, and in the Dallas Morning News also on September 17th, which by the way is National Physician Suicide Awareness Day. We published both of those op-eds that day. We've made a number of media appearances, and the reach so far that we've been able to garner and measure is over 65 million people we've reached with the story, and that number keeps climbing. Last night, it probably added 5 million to it easily, just as of last night. There have been over 70, probably now 80 articles that reference the Lorna story, including a very robust article, again, that published on September 17th in Vanity Fair, and a number of New York Times and USA Today articles. In the coming days, you'll see another large piece in New York Times, and then the New Yorker just finished a large piece that this weekend that will be being published soon. With the help of volunteers, we have stood up a website. We've started social media. We started a social media campaign around Standing with Lorna. You can see that information. Just a quick note about the U.S. News and World Report article. You can see it was published July 28th, the day the Best Hospitals in America came out. We intentionally did that day because we called on U.S. News and World Report to include a measure of the rankings of hospitals and health systems on the well-being of its workforce. We're in active conversations about how we might pull that off. In that article, we called on the healthcare community to recognize their significant role and really in addressing this. As we understand it, over 80% of the issues that create burnout in our clinicians are organizationally driven. And so healthcare leaders from across the country need to understand their role in addressing this issue. Here's a snapshot of the Vanity Fair article. Here's a a slide of our website with some of the statistics. I want to also note that we are not limiting our work to physicians alone, but to the mental health of all healthcare professionals. And so you'll see in the statistic on the bottom that not only is the physician suicide rate twice that of the national public, but so too is that of our nursing peers, who are definitely hurting. Another notable statistic on the bottom, which I think will make a lot of sense to you all, is that according to the research, there's a 200% increase in medical errors when healthcare providers are burned out. 200% increase. So if healthcare professionals aren't going to do this for themselves and take care of themselves, if you will, they need to do it for their patients. In terms of this conversation around shining a light and raising awareness, we've also raised awareness at a federal and state level. At the federal level, the Dr. Lorna Breen Healthcare Provider Protection Act was introduced by Congress, or into Congress in both the House and Senate this summer. We've been working on getting that legislation passed. The champions, the big champion is Senator Tim Kaine, although it has bipartisan support in both the House and Senate. And I'm going to show you a very short clip about that in a moment. And at the state level, we are working to evaluate licensure laws with a consortium of organizations doing that work. Here's a copy of the bill that was introduced by a bipartisan group of Senators Kaine, Young, Reed, and Cassidy, who's a physician from Louisiana. You may be interested in what that act has included in it. And what I would say is it's an excellent start and certainly not a silver bullet to solve all the problems, but it addresses this issue in an attempt to make a short or an immediate as well as a long-term impact. And so it addresses grants and provides grants for the training of health professionals, students, residents on the issues of burnout and suicide. It starts students early. Again, medical students, nursing students, any health professional students. It provides funding for evidence-informed best practices for reducing and preventing suicide and burnout among practicing healthcare providers, and funds a significant awareness campaign for many years across the country targeting healthcare professionals. I feel like I'm doing that a little bit of my own right now. And provides grants for employee education, peer support programs, and other things like that within health systems to help provide support to the healthcare workforce. And finally, like any good law, it attempts to study its success and measure whether it had an impact. Currently, both bills are in active discussion in the United States Congress. The Senate bill is being more actively discussed as a potential to be included in the COVID package, which, if you pay attention to these things, is actually being negotiated this week. You can see the list of both the House and the Senate, who the co-sponsors are. Importantly, there are also 70 other industry supporters, organizations like the AAMC, American College of Emergency Physicians, the AMA, the American Foundation for Suicide Prevention, the American Nursing Association, the American Psychiatric Association, the list goes on and on. In addition to that, we've managed just in the last weekend to establish a grassroots campaign, which I'm going to ask you all for a little help this evening on, but we've already generated over 4,000 letters to Congress just since Friday to support this legislation and the inclusion in the COVID package. So we got a little help last night from a friend, Chris Cuomo, on CNN. So I'm going to just play this very quick clip for you.
You know, look, one of the reasons it has to get done is we have to take care of the people who are taking care of us. Okay, we have to do that with the vaccine. We got to make sure we take care of them, and we got to make sure there's money for all the stress and strain. They are not doing the normal job. Being at this kind of capacity against the pandemic for a year, that breaks you down physically and mentally. Mental health care for professionals. Okay? You remember Dr. Lorna Breen? What just a beautiful example of humanity in action. Top ER physician, New York City, crazy pedigree. Everybody thought she was amazing. She was helping. She was vivacious. She was doing it for the right reason. She was putting purpose to passion. Then she dies by suicide out of nowhere in the frenzy of this fog of war against COVID. Her family says it should have never happened. The address on your screen is a place to go to learn more about a bipartisan bill that's been out since this summer. Will they make this part of the COVID relief package? Will they give money to our heroes to make sure they get the help they need for their head, for their heart, and their body in this war to keep us alive? That's for...
So we greatly appreciated Chris's help last night in helping this conversation forward. And so I'm going to ask you for your help. Right now, you can see the Take Action link on the bottom of the screen. You can't click on it, but if you go to our website, you click through, it's about 5 or 6 clicks, and you will automatically send an email or a tweet or a Facebook message to the negotiators of this package with a message saying, please include the Dr. Lorna Breen Healthcare Provider Protection Act. It'll take about 4 minutes of your time, and we would greatly appreciate if everyone on the call tonight did it to add to our 4,000 letters who've already been received. Quickly, because I'm running close on time, our state advocacy efforts are also going in parallel, working on a campaign called Humans Before Heroes, led by the American Medical Women's Association, and you can see a cross-section of partners, including our organization. And what we're doing is we're evaluating all 50 states' laws and trying to develop standard language that other states could use in their questions around mental health to make them appropriate for, if you will, for licensure applications and applications for renewal. And here's the website that we've been working on with the AMWA team. Also just some of their contact information if you're interested. So here's my contact information through the foundation, Corey at drbreenheroes.org. Jennifer's contact information as well. You can see our website information, our social media information as well. So we'll put I'll put the links in the chat as well. So with that, I'm going to turn it over to my partner, Dr. Bell, and thank you for the time this evening and look forward to conversation and questions on the other side.
Thanks, Corey. That was really heartfelt and something that I think we all need to hear. So I'm one of the intensive care and ICU ID physicians. I've been director of the medical ICU. I'm in the midst of the pandemic. And what I wanted to talk about was just a dedication to the healthcare workers, those who are suffering through either physically or mentally, and those who have died. I think it's important to always take a step back and just, really zoom in on what exactly we're going through in order to process and move forward. Dr. Breen, I think family, community, spirit, leader, advocate are all words that come to mind. And what was really hard for us, and by us I mean people in the leadership who are trying to manage our teams, was the response to her passing away in the emergency room. Despite her training in New York City, where she trained in a very tight-knit community, the Allen, where I did 3 months when I was a medical student, is a very tight-knit community. But she was well known outside of the Allen and outside of New York. She had colleagues in the emergency room who had trained with her, who she had taught, who had served on national boards with her. She was a superstar. And I can only imagine, I can't imagine actually what that feeling must have been like to see her come into the emergency room and hear about what had happened. And so when we reached out to make sure that resources were available to her colleagues in the emergency room in particular, a strange thing we noticed was that there weren't really a lot of hits and not a lot of faculty or nurses who wanted to really talk about it. And we knew what people were going through at home because we were getting text messages. And when I was talking with friends who were in the emergency room and all across the country, you could tell that there was a lot of suffering happening as a result of seeing something like this. But not that step to reach out to receive that help is something that healthcare workers are not used to doing and need help doing. And the fear of the consequences of getting that help is something I'm really glad that CORE is working on. Her dad said, make sure she's praised as a hero because she's a casualty just as much as anyone else who has died. So she is a death that directly links to COVID-19. This is a project from the Guardian that is tracking healthcare workers in the U.S. who have died from COVID-19. As of this morning, 1,445. And this is just what we know about it and what's been confirmed. The number is...
You're actually not hearing, I don't think, the screen.
Oh, all right. Let's see.
There you go.
All right. Thank you for that.
Well, I'm here, partner.
Okay, you got it? So I encourage you to go to this website. I can drop the link in the chat. But what it does is give stories of the people that you see here and many others and who they were. I think that there are so many times that we obsess over the numbers. And this is a pandemic that has been so wide scale and far reaching that we have to use metrics in order to really track what's going on. But there's a story behind each one of these numbers. One story that is behind these numbers are the disparities that we're seeing, and namely that African-American, Asian Pacific Islander healthcare workers are dying at a much greater rate compared to their white counterparts. And this was particularly true in areas that were underserved populations that have decreased access to PPE, decreased access to therapeutics, and community members who are at high risk and work in that same community. So this is something that we have to pay particular attention to and make sure that anyone, no matter where they're working in the healthcare field, has access to what they need to stay safe and healthy. Worldwide, over 7,000 healthcare workers are estimated to have died from COVID-19, and this amounts to a global tragedy. As Steve Cockburn notes, this is trying to save others in a crisis and dying of it is really staggering. And the pledge and the oath that we take to take care of patients is something that we take seriously. But when you see the ultimate consequence of it, that's when it's very difficult to process. But we do have to. Again, I want to get back to this notion of what does a number mean, because like many in this crisis, I have to focus on the numbers, but we have to remember the stories behind the numbers as well. This is Lisa Burhannan, who is 50 years old and died in Harrisburg, Pennsylvania. She was a volunteer hospital chaplain and social worker. She was specialized in trauma rehabilitation. So she saw patients who had PTSD and other mental health diseases related to trauma, and was a pastor in a local community. She founded a dance troupe that danced to gospel music and drove them to competitions, and was known as the Energizer Bunny, had a lot of energy and was always smiling, knew everyone and prayed for everyone who she encountered. And during the beginning of the crisis, she did have a lot of concerns around PPE in the hospital that she was working at, but saw that there was a greater need to provide masks and PPE to the community. So she started handing out masks going door to door in her community and handing them out, sometimes without one of her own because she wanted to make sure that others had a mask. But then she developed a very bad cough, one that was much worse than anything she had experienced before. And what was really sad is that she understood what was about to happen. She knew that she was someone who had risk factors. She had seen what had happened to her fellow healthcare workers. She called her mom and gave her her final wishes while she was still lucid and told her, "This is what I want played at my wedding, and here's who I want there. I want it virtual, and to come back again next year when it's over and celebrate my life." And she ended up passing away. You know, the concept of serving to the very end and putting your own life at risk is a theme that really rings true when we think about healthcare workers in this pandemic. So I'm going to try to advance here. You know, the other thing that we have to encounter is fear, and a real fear, especially in the beginning of this pandemic. There were a lot of concerns about healthcare workers getting infected, and rightfully so. Healthcare workers make up 3% of the global population, but 14% of all COVID-19 infections. So being on the front line does translate to a higher risk. And that risk means that physicians and other healthcare workers who are used to hoping for the best, but also used to planning for the worst, are taking steps to make sure that if worst case were to happen, their families were taken care of. So you see stories about doctors writing their wills, and even companies and legal outfits offering that service for free for physicians to write their wills and make sure that their families were taken care of. It meant doing things like changing your routine when you came home because we weren't sure if we were going to spread infection to our families. So the box by the garage here was my routine, and I stripped down and put the clothes in there and ran into the house and ran up to the shower. And then at that point, I could interact with my family. And this became so routine that later, when I was not on service but still going to work and would come home after not having been exposed to COVID-19 patients, my 2-year-old daughter would run away from me when I came into the door. And one time actually cried because I got close to her. So, the strain that this can take is astronomical. And, some of it is the dramatic sort of things that we see and have been documented well in the hospital. But some of it is just the small things that don't seem like a big deal, but in a sense are a dehumanizing aspect of your life that you have to live differently because of the pandemic. And all these things really add up and can become a silent storm that can really bubble over. I also want to connect this to the very real concern around PPE. And of course, in the beginning of the crisis, when we had to ramp up production on PPE, this was well covered, that hospitals that did not have access to PPE were coming up with all sorts of solutions, like wearing trash bags instead of a standard contact gown, and doing what they needed to do to protect themselves with gear that just was not adequate. I think one story that's gotten lost, however, is that this shortage is still very much a crisis. This is a survey of healthcare facilities from June to September, so just the late fall, asking what is your PPE supply? And you can see here, well over 60%, 70%, 80% of facilities are reporting that they have no supply remaining and at least one critical aspect of PPE that they need to take care of COVID-19 patients. The reason we don't know so much about this and has not been reported so much is where it's happening. It's not happening at this point in our hospitals that are well resourced and have purchasing power. It's in our outpatient clinics. It's in our long-term care facilities and our nursing homes. I've gone into 2 nursing homes at this point that were in the midst of COVID-19 outbreaks. And in both cases, they had run out of PPE and the workers were going around without the PPE, without any PPE. And really, what was really shocking was the lack of concern because they had moved past the point of anger and grief into resignation that this is the fate that we have we have to still take care of our patients. Even if we don't have the right gear, we're still going to do it. And so by the time we went into the facilities, there was just resignation that this was the way it was going to be for them, which is very sad. So this remains an ongoing crisis that we need to address. I often talk to my residents about what is fear versus courage. We have a tendency to try to mask our fears, and that's because becoming a healthcare worker, becoming a physician, a nurse practitioner, and to some extent involves going through rigorous school, making good grades, being top of the class, and having this facade of perfection. And any sort of thing that penetrates that facade is something to hide and keep away from others. And so we don't openly talk about our fears. And that's a detriment, because if we're not able to fully express the human side of ourselves, then it's hard for us to really perform at the top of our ability. The other part of fear is courage, however. The very real fear of taking care of COVID-19 patients was definitely there, but what we see over and over again is that there's another variable in that equation, and that is the assessment that something else is more important than the fear that you have. So in the case of healthcare workers, I may not have the PPE. I may not know if I'm going to get through this okay. I may not know if I'll live through this crisis, but there's something that's more important than my concern right now, and that is this patient in front of me who is sick and dying, and there's something I need to do about that, and this is what I pledge to do with my life's work. So this is a quote that I come back to find inspiration, because this is the story of the healthcare workers in the midst of this pandemic. The other part of being a healthcare worker is serving. And so I think it's important to just talk about, what does it actually mean to serve your community? Well, in the case of working at the University of Virginia, we have three main pillars, and one is patient care. And this is from the early days of the COVID-19 crisis. This is actually our non-COVID ICU patient who's walking around the ICU, and you can't see it, but she has a ventilator. So she has a respiratory therapist that's helping her walk around the unit and helping to get this patient better. We also have an educational mission. Education is the reason we have a future generation who can take care of patients, and the lessons that we impart to them are what improves healthcare delivery and access going forward. And even in the midst of crisis, this is actually a patient who was having a decompensation event and had somewhat stabilized. My fellow was teaching the residents, how do you approach this problem the next time so that you will know exactly what to do, and you can actually deliver much better patient care and be prepared for it. And then, of course, our final peg in the stool is research and excellence, and bringing trials like the ACT-1 trial and the first FDA-approved drug against COVID-19, remdesivir, which happened at the University of Virginia, is also a part of that story. And fighting on all these fronts to deliver patient care, to educate, and to push the bar for scientific discovery forward and be on that edge of discovery to make better outcomes for our patients. So all that's happening in the midst of us just showing up to work a day. I think that many people, chances are, if you're listening to this and looking at this, that you've been in the hospital at odd hours of the night. On the left here is a very familiar hallway to many people who are at UVA. This is the hallway that connects the medical center, the hospital, with the medical school and some of the medical research buildings. And when I'm on at night, my office is on the medical school side, and I tend to just go back and forth. And so I'm used to walking in this hallway. And what I noticed in the midst of the crisis in the hospital emptying out is that this became a very empty space. And when I walk in empty spaces, I just have thoughts about what I'm going through, the patients that I have to do things for, if I have anything on my to-do list. This night I was thinking about Dr. Breen and other healthcare workers, and I saw this gentleman here on the left. He had has a floor buffer there. He had gone past a spot that he probably could have just kept moving, but he looked back and saw that he wasn't satisfied with what he had done or the job that the machine did. So he backed it up and went back over that spot. No one's looking at him. No one's congratulating him. He's just taking pride in the work that he's doing and pushing forward and doing your job when no one's looking, when no one's congratulating you, and making your environment a better place, even if you're unseen, is something that we have to pay a little bit more attention to. He's also a member of a higher risk group if you were to acquire COVID-19. So he's high risk. He's a healthcare worker nonetheless. And what's interesting is that oftentimes these may be people we don't know that well. We know our professional colleagues very well, but it's not often that we've reached out to some of the support staff and asked them what they're doing, what they're going through. On the right here are people that we see every single day in the cafeteria who are extremely high risk, who are interfacing with people all the time, all day. I encourage you, when you see someone that you see over and over again, but you don't know their name, you don't know their story, just stop and ask them how their day is going. Introduce yourself. I found this to be very gratifying because it connects you with someone in a very different way and lets them know that, we're really in this together. And so I've tried to be mindful of this and to make sure to reach out to people of all walks in the hospital. I want to touch again on this theme of healthcare workers will not show you their cards. We have a tendency to shoulder other people's burdens, whether they're our patients or our families. And so when it comes to seeking care for us, there's often nothing left to give and no concern for our own well-being. This is a psychologist who specializes in mental health issues that healthcare workers face. And she says that, speaking about healthcare workers, Dr. Gold says, I know their calm surface appearance is the only armor they have left. Underneath it, many healthcare workers are barely keeping it together. They're anxious, they're afraid, they aren't sleeping, they find themselves crying more than usual. The overall feeling in my friends, family, and coworkers is one of impending doom and an existing gloom that is both physically and psychologically palpable. And these words they just seem so thick and tangible that they seem palpable. Like I could actually touch them and wrap my hands around this because it's so visceral. And it speaks to a lot of what we're seeing and what we may not be talking about with ourselves. But there are also some good stories that I like to share too. This is on the left, April Hyman. If you've ever met April, she's our MICU manager. She keeps everyone in line. She's really the glue that keeps the MICU together. She orders our supplies. She handles any issues that come up. She works with staffing. She makes sure scheduling is done. She's very much in the mix. Her father contracted COVID-19 around the summer of this year. And this was around the time when there were absolutely no visitors coming into the hospital at all. We were really connecting by phone. He came to our medical ICU where she was working. And so our first experience with having a family member who was dealing with a patient with COVID-19 in person was April, who was trying to do her job while still being a family member and trying to really manage those two. And I just remember the stress of taking care of her father when he was intubated, when we extubated him, when he had issues immediately after extubation, and walking that line between maybe having to go back on the breathing tube, and what that would mean for April was one of the hardest experiences I've ever had. But he pulled through. And there's this one moment that really demonstrated that. And it was a moment when he had started to come through a source of hospital delirium. And April asked him, "Daddy, who gets to drive your truck?" And we don't know what in the world that means. But he looks at her and answers, "Anyone but you." April starts to burst out in tears, happy tears, and jumping up and down because her dad's back. Turns out one of these family jokes that, we all have them in our family and no one else really gets them or understands them. But April's not a good driver. And her dad really rode her for this and said, anyone can drive my truck but you. And that's been the running joke in her family for years and years and years. So him answering that question that way let her know that I really do have my dad back and he's getting better. He walked out of the ICU about a week later and he's back to his normal activities, and someone that we managed to get through, but in a very stressful situation. I want to just share a few pictures of our COVID ICU staff. Here on the left were two of our nurses who are getting ready for a night shift to go in and turn a patient. We've been proning a lot of people. Up here in the middle is early on in our crisis when we had patients in the COVID ICU actually in the west side of the MICU before we went to the new building. And this was the night when we went universal masking because we had run out of positive pressure rooms. And so this was kind of launching into a new era where we were masking. And this was actually before the hospital was universally masking. And then other pictures of teamwork and camaraderie and people coming together to really do the remarkable. I love sharing that at UVA, our outcomes for COVID-19 are extraordinary. And we actually manage a sicker population than the typical hospital in the Commonwealth. And we have mortality outcomes that are about half of what you would expect based on our patient complexity. And a lot of that is a function of the teamwork that we're able to deliver. And not only that, but the racial disparity that we see in COVID-19, where African Americans are 3 to 4 times more likely to experience mortality, Hispanic Americans 3 times mortality. We do not have that in our ICU. We have a low mortality rate, and that mortality rate is equal amongst our different high-risk populations. So something that I'm extremely proud of that we've been able to do here. I want to close by saying, what is our part in all of this? This story is not over yet. A lot of it has been written, but there is a few more chapters to write. And we have to come together and really focus our energy on what to do now. I think that means continuing what we've been doing, wearing a mask, socially distancing, washing our hands, getting vaccinated, which signups are starting now, and we'll get rollouts into the greater healthcare community and Charlottesville. But as healthcare workers, we set that example for others that getting vaccinated is going to be the right thing to do, and how we turn this crisis around. I think we have to look out for each other in a way that we really never had before. And when we are in a conversation with someone and we share pleasantries and we say, "Oh, I'm doing okay," but you might pick up on something that seems a little off, that's not quite the same as what you expect. That's a moment where we have to actually dig in and find out there's something really troubling our colleagues, and looking to make sure that we're supporting each other. Educating your community is also very important. Advocacy is also important. These are our NPs talking to Senator Tim Kaine on a Zoom about mental health in the workforce, and they were just sharing what they were going through at that point. I think the more we talk about this, the more we normalize it, and the more we normalize it, the easier it is to access this care. And then the last thing I'll leave is the fact that, right now in our SPU, we have a team of nurses, our respiratory therapists, HUCs, physicians, fellows, many others who stand ready to do what needs to be done to turn the tide on this crisis. It's been extremely challenging managing patients in the COVID ICU. They're some of the sickest people I've ever had in my life. But what I've also learned is the true power of leaning on others in order to achieve extraordinary things. This is a crew that's suiting up, about to go flip a patient. We actually got a patient out of the ICU recently who was 500 pounds and 24 years old and 5'1", and came in severe ARDS. And we actually pruned her, paralyzed her, avoided cannulating her on ECMO as she walked out of the hospital. And this is something that in the beginning of the crisis, we would have never entertained trying to do this for someone with that sort of body habitus. But we made a decision together to push the limits and go way outside the guidelines that we have written to do something that we felt the patient needed. And we were able to come together and get it done and have a good outcome for that patient. Does anyone know what this place is? This is the third floor garden outside the SPU, or not the SPU anymore. I guess it's 3 South because the SPU has moved to the 4th floor. But this is a space that I've come to frequently when I'm working there, just to have a little bit of solace. There's a good view of the Blue Ridge Mountains. It's quiet, it's peaceful. There's a chair out there now. And it's one of the ways that I've used to reconnect with some sense of normalcy, even in the midst of chaos. And no matter how bad my day is going, if I feel like I don't really have the time to get out there, it always feels right when I do it. So if you have a moment, even if it's not this place, find your moment of solitude when you're in the midst of the craziness. That's all I have.
Well, I want to thank both of you. That was extraordinary, and you have from a national end and also used our local experience to speak to what is both a national and international issue. We've personalized it from what we have at UVA to talking about how healthcare provider burnout has existed well before this extraordinary situation. And as Corey has said, in 1 year, 400 physicians commit suicide, many of them medical students. We select for people with these driving characteristics, and then we don't give them the tools in order to be able to manage this and reinforce behaviors, which are basically sort of self-abnegation to larger causes. So this is real. And now you've brought up the concepts of mindfulness and self-awareness and understanding burnout and leaning on each other and removing the stigmatization that we may self-apply or feel that is applied to us by a system, and by recognizing the losses that we have now. And it builds on a theme. We had an earlier lecture on self-care by Professor Penberth here earlier on in this series as well, that really talked about what you can do for yourself as well. So I'm truly grateful for both of you, and I see comments that have really echoed this as well. And I guess perhaps in closing, is there sort of a single distilled kind of thing that you'd each like to have us use or take as we sort of think for ourselves over the next days? Maybe I can ask both of you for that.
I think I can go first, but I think the characterization of healthcare workers as superheroes can kind of cut both ways, because we rarely see our superheroes struggle. And that can sometimes lead to this notion that if the person beside me seems like they're not struggling and they're doing okay, then something's wrong with me. I think we have to emphasize the human part of superhuman, and make sure that we recognize that this is affecting us in a very deep and profound way. And if we're not able to talk about it, we're not able to heal ourselves. So in our division, we actually have mental health discussions, whether they happen by chat or in the beginning or the end of a meeting. We just ask each other how you're doing, and we talk about our kids. We talk about the things that are stressing us, the things that we're worried about, and it's a open mic, and that I found that to be extremely helpful. A lot of things that I've gone through, more recently, trying to figure out how to essentially ration care for ECMO and transfers is always a difficult situation, but now we're getting staff who have colleagues, parents, friends who are very sick and in need of transfer at higher levels.
It's both an internal mindfulness, but also an awareness of our surrounding circles. And perhaps if I can try to distill a piece of it, which is that awareness of everyone around you and reaching out to them perhaps on a daily basis, and just that virtual touch-in that says, where are you at? Corey, can I ask you, in addition to emphasizing, of course, the extraordinary work in your foundation, we'll make the link available, please.
Thank you, Ziv, and thanks again. We've said this all along. For the circumstance that brought me here, this happened in a moment. This happened to someone who had no prior history of mental health issues, known or suspected. And so, as I said in the video, if it happened to Lorna, it can happen to anyone. This isn't about a toughness contest. And so to that end, check in on each other. Ask each other how you're doing, and then ask the question again, how you're really doing. I truly believe if someone had done that, I wouldn't be here talking to you tonight. When others of my sister-in-law's colleagues recognized that she was struggling, no one took her aside and said, you need to go home. I would implore upon everyone here to remember that when you see someone walking down the hall who looks like they may have had a bad day, just stop them and ask them how they're doing and how you might help. You could literally save a life. Thank you so much for having me tonight. Thanks, Tyson, as well. It's really been a pleasure. Thank you all.
Thank you both. Thank you.
Thank you.
Good night.